we should say that since its first description by Jean-Martin Charcot, ALS was considered as a motor neuron disease. But in the last few years, we noticed that there is an extramotor involvement of the disease, such as cognitive, autonomic involvement, and in the last few years, we also studied the sensory involvement in these patients. And we look at the clinical part of sensory involvement by applying some dedicated sensory questionnaires, such as the Small-fibre questionnaire SFN-SIQ. And we demonstrated that the patients with ALS complain of sensory symptoms in a percentage about 35% of patients. This is quite high and was unexpected. And among the sensory disturbances, we described that small fiber sensory disturbances, such as burning pain, was the most frequent disturbances among our patients. And correlation of these clinical symptoms, we also found in about 15% of patients also a sensory polyneuropathy that was with a length-dependent pattern in about 10% of our patients. And this is in line with the previous literature. In our patients also we performed a skin biopsy to evaluate the small sensory fiber involvement in these patients. And by using this advanced technique, we demonstrated there is a huge denervation, sensory denervation in our patients. And this denervation was in a pattern that was different depending on the stage of the disease. So in patients with later disease or later stage of disease, we found a profound loss of Meissner corpuscle in the glabrous skin. Instead, regarding the intraepidermal nerve fibers, we also found a regeneration pattern. So two different patterns in the hairy skin and the glabrous skin. So Meissner corpuscle, we found a linear decrease. Instead, for the intraepidermal nerve fibers, we found also a regeneration, a pattern that was also confirmed in our longitudinal studies. We found that patients with a more aggressive disease also showed higher regenerative pattern. So this kind of regenerative pattern was unexpected. And we think that it is an attempt of our body to counteract the disease with a high inflammatory tone. So to respond, as a response to this kind of inflammatory tone, our body respond with this kind of regeneration pattern. We think that is a non-invasive prognostic biomarker, so it would be really useful as a prognostic biomarker, but in the future we think also that can be used as a diagnostic biomarker because we are also working in figure out some specific biomarker of ALS, such as TDP-43 in the skin. This would be a novelty in the literature, because we know that TDP-43 is already present in the periphery, such as the motor nerves, in the muscles. But as far as we know, we don't know if there is also TDP-43 in the skin. So we are working on this topic now. So to use the skin not only for prognostic biomarker, but also for diagnostic biomarker.